Taking care of your aging parents. Taking care of your aging parents is something you hope you can deal with when the time comes. But one thing you probably hope you never need to do. Taking care of your aging parents means helping them prepare for the future, and this could be frustrating both physically and emotionally. When the time comes for you to take care of your parents, you may be certain of only two things. Your parents need you, and you need help. This is the first of our three-part series on caring for your parents as they get older. Speak with your parents about the future. Start taking care of your aging parents by talking with them about their needs and wishes if they're able. Sometimes, however, they may not be willing to speak with you regarding their future, either because they're afraid to face it or because they resent your interference. If this is the case, you may have to do as much planning as you can without them, or, if their safety or health is in danger, intervene as caregiver anyhow. Prepare a personal data record. The initial step you must have is to ask your parents to assist you prepare a personal data record. If they're unable to assist you, you'll need to look for the information yourself. A personal data record is a document that lists information that you might need in the event your parents become incapacitated or die. Information that should be incorporated is financial information, legal information, medical information, insurance information, and information regarding professional advisors and the location of important records. Get advice. You cannot know everything, and you most likely don't have enough time to discover every little thing you need to know to care for your parents. That's why you should seek advice from professionals. Some advice will be free, and some you will need to pay for. If you live far from your parents or are too overwhelmed to handle your parents' affairs, you can hire a geriatric care manager who will evaluate your parents' condition, suggest options, and coordinate professionals who can help. Additionally, talk to your employer. Some companies have established employee assistance programs that offer guidance and assistance to people who are handling personal challenges, including taking care of aging parents. Get support. Don't try to care for your parents alone. Many local and national caregiver support groups and community services are offered to assist you deal with your taking care of your aging parents. If you don't know where to start finding help, call the Elder Care Locator, an information and referral service sponsored by the federal government that can direct you to resources available nationally or in your area. Call the Elder Care Locator at 800-677-1116. Housing and health care advice. If your parents are like many older individuals, where they live will depend upon how healthy they are. As your parents grow older, their health may deteriorate so much that they can no longer live on their own. At this point, you may need to find them in-home health care or health care within a retirement community or nursing home. On the other hand, you may want them to move in with you. In addition, you will need information on managing the cost of health care, long-term care insurance, major medical insurance, Medicare, and Medicaid. You can contact the National Association for Home Care, Visiting Nurse Associations of America, Centers for Medicare and Medicaid Services, formerly known as the Healthcare Financing Administration, the American Association of Homes and Services for the Aging, American Association of Retired Persons, or AARP, the Health Insurance Association of America. You should also get financial advice. If your parents need help managing their finances, you may need to contact professionals whose advice both you and your parents can trust, including one or more of the following individuals or organizations. Contact your financial planner, your banker, your investment counselor, your tax attorney, or the Social Security Administration. Get legal advice. Legal advisors can help you plan for your parents' incapacity, including preparing documents such as power of attorneys, medical directives, and living wills. Contact nursing home ombudsmen. Set up and keep track of guardianship, prep wills, give tax advice, and provide bill payment and representative payee assistance. Many states provide funds for the delivery of free legal services to the elderly, and many attorneys specialize in elder law, so finding legal advice shouldn't be difficult. Contact your attorney, the National Association of State Units on Aging, the American Bar Commission on the Legal Problems of the Elderly, or legal counsel for the elderly.